Hello everyone again. So I'm here today to talk about how massage can help with depression and also suicide and trying to prevent suicide. So the leading cause of suicide is either undiagnosed or untreated depression. And, 1 in every 25 suicide attempts are successful. Up to 15% of people with clinical depression will die through suicide. 79% of suicides are men. And 1 in every 65,000 children aged between 10 and 14 commit suicide every year. So, this really is, an increasing problem. Not everyone with depression will have the same symptoms. So, the frequency, severity, and duration of symptoms will depend on the individual and, their particular illness or form of depression. But massage has been shown to reduce the symptoms of depression and can therefore work, towards prevention of suicide in someone who maybe has, those kind of thoughts. Symptoms, I'm sure a lot of us are probably aware of the symptoms of depression. Feelings of hopelessness, persistent sadness that won't go away, sometimes without any particular reason, feelings of guilt, feeling worthless, generally feeling irritable and anxious, maybe, excessive fatigue. There might be days where you just can't get out of bed, lack of interest in pretty much everything, and also sort of sexual dysfunction as well. Difficulty in making decisions, concentration and memory problems have actually been shown through brain scans. It's been proven that those with long-term depression and stress will experience memory problems, overeating or loss of appetite, insomnia or excessive sleeping, persistent aches and pains that, don't seem to ease, whether it be headaches or digestive issues. But obviously the sort of most severe end of the scale, we're looking at things like self-harming, which is a coping mechanism. It's a way of, if you feel pain on physically on your body, it kind of diverts the brain away from, the emotional pain that you're going through. And of course, suicidal thoughts and, worst case attempts. As many people, I get really tired of hearing people say, oh, you're just having a bad day. Depression is not just having a bad day. And again, I think it's people that have suffered depression, they're the ones that can really understand this. The effects of depression can be completely devastating. It can negatively impact on your whole life, but also on chronic conditions. So things like asthma, diabetes, heart disease. It can make these issues worse. It can also be caused by these issues. It can also cause short-term disability, absence from work, which obviously then has a knock-on effect on, your sort of financial state, on your relationships, on, everything. So massage can help to improve the mood and reduce the symptoms of depression. And it can be particularly useful, as you will see from some of my future videos. It can be particularly useful in chronic pain patients or anyone suffering from a terminal illness. Certainly cancer patients, including children. Massage can be really beneficial. Pregnancy issues, teenage mums, even women with, premenstrual disorders or, menopause, which obviously we all know can, affect our mood. People with tension headaches, migraines, or any kind of chronic disease such as multiple sclerosis or fibromyalgia. But psychiatric patients as well, of any form, massage can really help. So if we look at the research that's been done, it has shown that the effects of massage in treating depression and anxiety is actually at approximately the same level as psychotherapy. And this is because depression has physiological components. So, many clients who have massage for physical pain will often suffer from depression. There are different types of depression which are going to respond to massage differently because they manifest themselves in different ways, and some will, have those physiological components more than others. So the types of depression that we see. So sort of on the milder end of the scale, we have situational or reactive depression. And this is basically a reaction to a particular event. One of those stressful life events such as, death or, it could be a family argument or, I don't know, loss of a job or home or, it's usually down to an identifiable cause. And certainly you can watch my previous video on how massage helps with grief, which will give you a better insight into the benefits there. You've also got family of origin depression, which is more psychological in nature than the reactive. And it's usually due to unresolved issues in childhood. The body has a long period of time to really sink into a depressive structure. So medication is often required, when issues arise due to biochemical changes. But massage can help to just boost the endorphin release, in people that have this kind of depression. We then have moderate depression, which is longer term than reactive depression. But whereas reactive has an identifiable cause, this moderate depression doesn't. There's no identifiable event or cause, to why you're feeling like this. It can be a seasonal thing, requiring medication and therapy. It may involve biochemical changes, So anyone, with this particular type of depression should be monitored by a mental health team when undergoing massage therapy. And that's really it's just a precaution, and to ensure really that the client has, ample support. Obviously, massage can, bring out emotions. So, you want to know that, your client has that sort of backup support system in place. And then, of course, we have our severe depression, which, requires heavy medication, sometimes hospitalization for chemical and psychological therapy. And in these cases, massage will really only take place after that treatment, has been given. And that's, again, it's to ensure that the client gets the support that they need, before any emotions may be released that, they're maybe not in a place to deal with, without that support system in place. So, in severe depression, massage should really only be done, in collaboration with a psychotherapist, and that's, that way, you can monitor for, any relapse or any, suicidal tendencies. So then we have chronic depression, which, that can be moderate or severe, usually with a significant endorphin imbalance and structural changes. And again, this, long-term depression, it quite often does require therapy or medication. So, how does depression change the physiology of a client? So, the effect of massage on the physiological changes from depression are really what makes it surpass, medication and psychotherapy as a treatment. When there is structural collapse in a depressed client, there are, a few physiological changes that, that will take place, and that can be helped by massage. So, firstly, you're going to end up with shortened abdominal muscles and a tightened diaphragm, which pulls the chest downwards and forwards. And quite often, you can tell when someone's depressed by their posture, they're sort of a bit slumped over. And what this does is it actually restricts your breathing ability, which then obviously is going to have a knock-on effect on, oxygenation of all your tissues, and your energy levels, hence why a lot of depressed people, suffer with chronic fatigue. You're going to get medial rotation of the shoulders, so an internal rotation of the arms. So your shoulders are going to kind of come round and forwards. And this can cause kyphosis, which is basically curvature of the spine. And again, this is going to restrict the breathing even more. And this reduced thoracic support, again, it causes the head and the neck to drop downwards and just distorts all of the upper body. And so the aim of massage therapy is to repair these structural changes that we've just mentioned in order to really improve the breathing process. This improved physical support will then help the client to feel stronger and more able to deal with the psychological issues that are going on. And so this is basically achieved in a few different ways. We work on releasing the abdominal muscles and the diaphragm. We work on the chest muscles to improve that medial rotation, and just help the shoulders sort of relax back. Working on the muscles around the front of the shoulder and the upper arms will help resolve the internal rotation of the arms. And also working on the neck muscles and across the top of the shoulders. And so working on these areas, as I say, will just help kind of open up, give you that thoracic stability, help you breathe much more easily, and, so that you're bringing in more oxygen, and you're going to kind of hopefully then improve your energy levels, and just start to feel a bit more positive and, able to kind of do those activities that, when you're depressed, you've got no energy really to do. So once we've worked on those areas, also any compensatory hyperextension in the legs can then be addressed. And by improving the breathing, as we say, the client will feel more energized, and they can start, participating in activities. As we know, massage has been shown to, improve endorphin release, the oxytocin, the serotonin, the dopamine, and inhibit those stress, inducing hormones such as cortisol. So, this again will help improve the mood, and hopefully in easing the depression will, also reduce the likelihood of, suicidal thoughts and self-harming and, all those sort of negative behaviours. So that is how massage can help with depression, and, those that are having suicidal thoughts. Any questions relating to this video, please feel free to leave a comment or contact me through my Facebook or Instagram, and I'll do my best to answer any questions you have. But for now, that's all from me. So until next time, it's bye from me.